All right, so today we are talking about Chapter 25, Therapeutic Agents for the Immune System. In this particular chapter, we will be going over the following objectives. The objectives in this chapter include everyone being able to describe the organs and the cells of the immune system in their roles. By the end of this presentation, you should be able to list the primary signs and symptoms of common conditions that's associated with dysregulation of the immune system, and also be able to recognize prescription and over-the-counter drugs that's used to treat common conditions that's discussed in this chapter. You should also be able to write the generic and trade names of the medications discussed in the chapter, as well as list the appropriate auxiliary labels when filling prescriptions for drugs discussed in this chapter. And you should also be able to discuss immunizations and be able to differentiate between the different types of vaccines. So now that I've talked about the objectives, let's next go into the anatomy and physiology of the immune system. So our immune system is built up of uh, lymphoid organs. And so we have a lymphatic system. And so inside of our lymphatic system includes lymphocytes, lymph nodes, and phagocytes. It also helps by being the filtering system for the interstitial fluid. So when we think about our immune system, think of it as our body's built-in defense mechanism, which is going to help our body from uh, anything that tries to invade our organisms. So our immune system works as a built-in defense mechanism that helps protect it. So inside of our immune system, we have our lymphatic system. We also have the bone marrow, which works by having the production of blood cells. We have our thymus, which produces and um, educates the lymphocytes. And then we also have our spleen, which filters the large amount of the red blood cells. And it also works by being the primary site for the immune response to blood-borne diseases. So when we think about our immune system, one thing that our immune system represents is our lymphocytes. So with our lymphocytes, they're made up of T cells and B cells. And so our B cells work by producing the antibody that's going to be used to attack anything that's invading our bodies, such as like bacteria, viruses, or toxins. And our T cells work by directly killing the infected host cell. Um, and then it can also um, protect and start by building our immune cells. So when we think of lymphocytes, one thing we should begin to think about is the leukocytes. So leukocytes represent white blood cells, and so some examples would be the neutrophils, the eosinophils, macrophages, mast cells, NK, which is the natural killer cells, and then inside of the leukocytes, you also have the T cells and B cells, which I just gave an example of that. So leukocytes represents WBCs, which is abbreviated for white blood cells. Red blood cells are called erythrocytes. So anytime you see the word cyte, C-Y-T-E, that is the medical term for cell. And leuko, L-E-U-K-O, the medical word for that in layman's terms is white. So leukocytes means white blood cells, and erythrocyte is red blood cell because erythro, EYRTHRO, its medical term definition is red. So erythrocyte is red blood cells, whereas leukocyte is white blood cells. So now that we've gone over some of the information about the leukocytes and understanding the differentiation of the T cells and the B cells, let's next learn about the different types of immunity. We have innate immunity, which is where the cells that respond rapidly to an infection. So you have the phagocytic cells, which release the cytokines to facilitate inflammatory response. So it's known that when or if we should hurt ourselves, and inflammation begins, that's our body's natural response to the ailment. So the purpose of inflammation is for blood to rush to that site. Um, if you continue reading the chapter 25, it goes more into specifics as the purpose of inflammation and how um, some of the effects of what happens when inflammation happens. So it's our body's natural. I'm trying to also find that in the book so that I can also reference that for you guys as far as which page to get more familiar with, to learn more about the infection, the inflammation, excuse me. But continuing, another type of immunity would be humoral immunity, and that's produced by the antibodies. So it's basically an antibody mediated immunity. So you have B cells, which become plasma cells that produces specific antigens for invaders, and they become memory cells later. And then you have the T cells, which expand to uh, to form an army to eliminate the pathogen, and then it represents the memory cells, which rapidly destroys the antigen. So you have two different types of immunity, the innate immunity and the humoral immunity. And so in learning more about the cells and the mediators of the immune system, we learned that uh, one of the lymphocytes, such as the natural killer, um, the natural killer cells are a lymphocyte that forms to specialize in killing the tumor cells and some virus infected cells as part of the innate immune response. And then the bone marrow produces the natural killer cells to circulate through the bloodstream. And so in learning about the different types of immunity, we'll next learn about the inflammatory response, as I was trying to give some examples of that. So the inflammatory response is a necessary response to bodily injury. And so some of the side effects of inflammation would include swelling, redness, heat, and pain. And with the inflammatory response, it can cause loss of function of the affected area. And so the purpose of when a person has inflammation, there is blood rushing to it. So there is a vasodilation, which I was trying to explain earlier, but this slide further proves my point that there is an increased blood flow to the area in the inflammatory response. And so now that we talked about the inflammatory response, we'll learn about anaphylaxis. So anytime that a person takes something and they have an allergic reaction, anaphylaxis is the most severe case of an allergic reaction. And so examples of a person having anaphylaxis would be if a person is allergic to, like, say, a nut allergy, or maybe they're allergic to sulfa. So 9 times out of 10, if a person is allergic to sulfa, they're also allergic to onions. And so there is a medication that could help reduce the swelling in case of anaphylaxis, and that drug of choice is called epinephrine, which is used to reduce the swelling in the airways. So the main drug that would be prescribed for a person who might have an allergic reaction to something might be EpiPen. And so how that is used is the person would actually inject the EpiPen into someone's muscular system so that the medication can be dispensed in the patient's body. So now that we talked about anaphylaxis, we'll next talk about some autoimmune disorders. So one of the autoimmune disorders is type 1 diabetes mellitus, and so that abbreviation is T1DM. And so we learned earlier in this particular course that there are different types of diabetes. You have type 1 diabetes, type 2 diabetes, and then you also have gestational diabetes, which is diabetes that occurs in women that are pregnant. So for type 1 diabetes, that is where the person is insulin dependent, meaning they have to inject insulin inside their bodies. Other autoimmune disorders include Crohn's disease and myasthenia gravis, which we learned about when we learned about the nervous system disorders. Another autoimmune disorder is SLE, which is the abbreviation for systemic lupus erythematosus. You also have RA, which is the abbreviation for rheumatoid arthritis. And then you have thyroiditis, Hashimoto thyroiditis, as well as Graves' disease. So these are some examples of the autoimmune disorders. And as we continue talking about them, I'll also go over some examples of the medications that help treat them as well. Some other autoimmune disorders would include the biological response modifiers and its targeted therapies. And then you have a turnoff to certain cells that works by diminishing the inflammatory process. So now that we've talked about some of the examples of the autoimmune system, we'll next learn specifically what each of those autoimmune disorders are. And so with the SLE, which is abbreviated for systemic lupus erythematosus, it's a chronic inflammatory disease, and it works by affecting any organ in the body. Some of the symptoms of SLE include fatigue, fever, and weight changes. Now, the drug treatment could include NSAIDs, which stands for non-steroidal anti-inflammatory drugs, and other medications that could be used would be immunosuppressive agents. There is a clinical course of SLE, which is highly variable. And with SLE, nearly all SLE patients can experience various symptoms that are somewhat nonspecific. As I mentioned, some of the symptoms include fatigue, fever, and weight changes. And so with this particular disorder, the autoantibody production is an SLE hallmark. And so although the condition's exact cause is unknown, there is a variety of conditions and events that have been linked to SLE flares or even a first symptom occurrence. So such events, as an example, could include pregnancy, some severe infections, exposure to ultraviolet light, and then also surgery. And so I mentioned some of the drug treatments would include NSAIDs. Another drug treatment that would assist in it would be hydroxychloroquine, glucocorticoids, and then also other immunosuppressive agents to help. And so now that we learned about SLE, we'll next learn about RA, which again is the abbreviation for rheumatoid arthritis. Now, rheumatoid arthritis is an autoimmune form of arthritis. It can lead to deformations of the joints and of the bones. In figure 25.10 in your book, you'll see a picture of what severe rheumatoid arthritis looks like. Now, studies have shown that it affects more women than men. And there is also a different type of rheumatoid arthritis that affects children, and that's called juvenile rheumatoid arthritis. And so in children, it causes deformity of the bones and of the joints. And so some treatment for rheumatoid arthritis would include physical therapy, some medications such as anti-inflammatories or even analgesics. And then there is even a specific drug class called DMARDs, DMARDS, which stands for disease modifying anti-rheumatic drugs. Another treatment for rheumatoid arthritis would also include diet. So now that we talked about rheumatoid arthritis, we're going to next learn about Graves' disease. Graves' disease is an autoimmune disorder that results in thyroid gland overstimulation that can lead to hyperthyroidism. And so hyperthyroidism is where the thyroid is too high. So always remember, anytime you see hyper, Hyper, that means high. So hyperthyroidism would mean high thyroids. So the underlying cause of Graves' disease, it has an underlying cause of 50 to 80% of cases of hyperthyroidism. Now the prognosis is good if it's caught early. At this time, there is no non-drug treatment available, so the condition will be treated with anti-thyroid medications. And so some of the examples that would help treat the Graves' disease would include looking at which particular medications. It would include tapazole, which its generic is methimazole, and then you also have propylthyrosol, which its generic abbreviation is PTU. So if as a pharmacy technician you see PTU written on a prescription, it would represent the medication generic name propylthyrosol. And so other drug treatments for hyperthyroidism would include radioactive iodine or even surgery. And so, in continuing learning about other types of thyroid disorders, there is Hashimoto thyroiditis. And so, it's characterized by autoimmune mediated destruction of the thyroid gland, and it's caused by genetic and environmental factors. And some of the treatment for this particular disorder would include thyroid supplementation and thyroid replacement agents, and these are taken for life. So any person who is diagnosed with this particular condition would always have to take medications so that their thyroids can at least be, what's what I'm looking for, continue to be built up, since it's a destruction of the thyroid gland. And so now that we talked about the different types of thyroid disorders, we're next going to learn about transplant rejection. And so patients who have failing organs might have to go through a transplant. And so when a person goes through a transplant, there is medications that the patient would have to take for life so that the transplant does not reject. And so with transplant rejections, you have immunosuppressive agents that's used in the management of organ transplants. And the immune system actually recognizes the transplanted organs as foreign. So it's basically something that their body did not automatically start with. So any transplant, is the body automatically knows it's something that's foreign. So the goal of a person taking a medication, a transplant medication after they've gotten a transplant, is to keep the organ viable. And so for transplant rejections, it's avoided. They should avoid people that are ill because they already have a compromised immune system since they've had a transplant. And so it's always encouraged that they stay away from people who are sick because they don't want those organs that have been transplanted to fail. And so in the transplant rejection, it's the host immune system that recognizes the transplanted organ is foreign and could begin to attack it. So medications will be taken to avoid the transplant rejection. And so some examples of medications that could be taken in case of a person who's had a transplant. For example, if a person had a kidney transplant, a person might be prescribed Nulojix, which its generic is Belatacept, and so it works by being a prophylaxis of kidney transplant rejection. And then another kidney transplant rejection would be Rapamune, which its generic name is Sirolimus. These are some examples. Now, in a rare case, when it comes to medications that's used for patients who've gone through a transplant, it's always important as a pharmacy technician to always, if there is a patient that is coming to your pharmacy and they have a prescription for the transplant medication, you always want to keep that medication in stock. So relatively, maybe the day before or maybe the week of the patient's refill, you may want to make sure that that medication is in stock because the patient cannot go without that medicine. So these are one of the main important things to understand when dealing with ordering medications for patients, is to make sure the transplant medication is definitely in stock, because you never want to be at this point where the patient needs the medicine and it's not in stock, especially if they're coming for a refill. So now that we talked about the transplant rejection, we'll next learn about immunizations. And so immunizations work by protecting communities better from diseases such as chickenpox, measles, and also the flu. And now you have people from countries where immunizations aren't available. They're at higher risk. So immunizations based on some physicians and people in the healthcare field, immunizations are recommended for children and adults. And so with immunizations, you have different types of vaccines and different types of vaccines available. And so one of the vaccines available are viral vaccines. And so you have viral vaccines for the measles, the mumps, and the rubella. And so the type of vaccine for that is going to be the MMR. And so you also have a viral vaccine for chickenpox, such as oral polio, smallpox, and varicella. You also have bacteria vaccines and also miscellaneous vaccines. And so some examples of the vaccines, that's like, say, miscellaneous. You even have a HPV vaccine, which helps treat the human papilloma virus. You also have hepatitis vaccines, and so hepatitis represents inflammation of the liver. So anytime you hear hepatitis, Hepatitis, itis represents inflammation, and hepat, Hepat, represents liver. So hepatitis is uh, disease, inflammation of the liver. So you have different type of hepatitis vaccines. So you have hepatitis A vaccine, which its brand name would be Havrix, or an hepatitis B vaccine, which its brand name would be Injurix B. You also have other types of vaccines. You may have heard of when babies are first born, they might their physicians might recommend that they get vaccinated within the first, I want to say, 2 months, 4 months, 6 months, and 15 to 8 months. And so You may have heard of the vaccine Tdap, so the Tdap shots. Um, just giving that as an example of the vaccine types. And so now that we talk about vaccinations, we'll next learn about the storage of vaccines and the antitoxins and the antivenins. And so according to the CDC, which stands for Centers for Disease Control and Prevention, you want to always follow their guidelines when it comes to keeping vaccines effective. And so it's encouraged that the vaccines should be stored at temperatures between 2 degrees and 8 degrees Celsius, and some may even be frozen until they're ready for use. And so with some of the vaccinations, the antibody-based therapy provides protection, and then with the antivenoms, those counteract against poisons. And so as a pharmacy technician, there are some states that even allow for pharmacy technicians to administer immunization, a vaccine. However, that varies based on the state's requirements. So for us in the state of Florida at this time, pharmacy technicians are not allowed to um, vaccinate patients. However, there are some states that do allow that. And so this is actually going to complete our presentation on chapter 25 as we learned about therapeutic agents for the immune system.